on today's Tips for Physical Therapists from Prosthetists. Today I just want to talk about having the freedom to tell your patient, oh, come on, you can walk better than that for me. And some of that has to do with all prosthetic componentry today. You see, these things are fantastic. It's so much better than when I got in the field. But the reality is they still do not completely replace original equipment. And one of the primary places that I frankly find a little irritating is nobody's come up with a prosthetic foot that dorsiflexes actively in swing. So, without exception, if you know what you're looking for, you will see gait deviations with amputees that have a prosthesis in their walking. So we are varying from normal human locomotion. But I really just want you to know that as a jumping off point for you to understand that it's okay if your patient's not walking clean and nice all the time. We want you training towards normal human locomotion. We want you to be able to say, oh, come on, you can walk better than that for me. Do your nice walk. But the reality is because of both their accident, injury, time off of their limb, and the fact that no prosthesis is a perfect replacement for original equipment, there's going to be things that they will likely do that are more efficient for them. And efficiency really matters. We'll do a deep dive on efficiency at a later date, but the reality is with every segment that they're missing, energy expenditure goes up pretty significantly. So we want you to let your patient know that, hey, it's okay for you to walk like that if that gets you further. But we want you to be working on getting them where they can walk clean, where they can walk nicely, where it is in the context of normal human locomotion, because eventually that likely is going to be one of their most efficient gait patterns. But even in long-established amputees that are strong and do amazing things, you will see when nobody's watching and it's just about them getting around, that they'll frequently have some type of gait deviation that just actually winds up being more efficient for them because this isn't original equipment. So appreciate the fact that you're going for the gold standard, normal human locomotion. We want you to understand that we want you pursuing that. We want you giving your patients grief to get there. But we also want you to realize that because of some of the limitations of prostheses, because some of the journeys your patients have gone through, it's okay for them to have a gait that's not as nice, that's just more efficient and gets them by. But we want them to snap to and walk nice when we ask them to. Thanks a lot. Bye.